So with the skin check, after I have checked the whole body, or during that when I'm using my overgrown magnifying glass, I actually have what we call a dermatoscope. And it's like a little magnifying microscope, if you like. And if there's any lesion that stands out or that I want to have a look at some of that internal structure a bit more, I use that. So don't be surprised if the doctor suddenly grabs something and goes, oh, excuse me, and gets really close and has a look, puts that on your skin and has a look at that. And they're just assessing to see whether there's any features that they think maybe need further investigation or whether it's something that's fine and we can just move on. With that magnifying glass, it depends which one people have got, but mine actually goes up to about 2 or 3 times. You can get them to 10 times magnification, which does mean that it's going to show so much more. But then when we look at it with the dermatoscope, it uses polarized light as well. And you can actually see more of the structure and the vessels within a lesion and that edge of the lesion, and also the size of it. It's got a measuring device on it. So it's got all these features and it augments what we can see that you cannot see with the naked eye. I can't see the blood vessels on a lesion with my naked eye, but with my dermatoscope, I can. So it's so important. Early detection is imperative. I would much rather remove something that's 3 millimeters wide, and then the border around it can be far less than something that's the size of your thumbnail or something like that, which takes a much wider excision to remove it all, so that I've got all the cancer cells. Because it's not just that lesion, there might be cancer cells around it, so we want to make sure we've got it all. Cure rates are far better when we get them far smaller and they've got far less chance of metastasis, so they haven't travelled off to another organ or something like that. So it's so imperative that we get them as early as we can, which is why skin checks are imperative. And I think in Queensland, as soon as you're an adult, you should be getting your skin checks every year. And to be honest, I have a lot of parents say, oh, when should we start them? As early as you think it's appropriate for your child, that it becomes normal for them to go to the doctor once a year, say, hi, how are you doing? Have a bit of a conversation and then examine your skin. It's better to get that as a habit early, and annual skin checks from 18, 20, especially in Queensland where we spend so much time in the sun.